Thank you for joining my presentation, Improving Communication Amongst Healthcare Team and Patients in Respiratory Care. My name is Terence Shenfield and I am the co-owner of A&T Respiratory Lectures. So why is this an important topic? Why would, as a respiratory therapist, we need this? Well, when you think about a patient that comes in the hospital, they could be injured, they could have some kind of illness, they may need some kind of operation, and they're apprehensive, they're scared of the unknown, they feel they lost control, they have confusion, they have grief, they have anger, they have depression, and definitely have some form of anxiety. Can you imagine if someone has cancer, they've been diagnosed with cancer or other heart disease? They're really anxious and scared. So, as a healthcare practitioner, we are the number one source of information between what they have and what we could do for them. So, we really need to show some excellent communication skills to really reduce their anxiety, to give them more information, to really help them understand exactly what's going on. Some of the basic skills we need to have is active listening. We really need to be able to listen to a patient and we need to be able to respond appropriately. In other words, you shouldn't be lying to the patient. You shouldn't be talking down to them. You should not show them pity. You should definitely have some form of empathy. So, this is a really important topic because we communicate with patients under a time of great distress. And as a healthcare team, we need to be able to relay important information to each other. So the goal is to develop a strong trust between the patient and yourself, as well as a strong relationship with the healthcare team. This is the whole purpose of this presentation. In today's objectives, we're going to be describing the role of communication skills in reducing harm to the patient. We'll also be talking about describing ways to enhance the quality and effectiveness of communication. Not everyone knows how to communicate. Not everyone knows how to listen. So really, we're going to go over some basic skills you need to have effective communication, which could help you on the job as well in personal life. We're going to talk about various methods of communication to minimize errors and improve patient safety. This is really important. Misinformation, miscommunication is a root cause analysis of people who have some kind of harm. So you really need to understand how to have effective communication. I'm going to describe ways to improve communication with patients. When you talk to a patient, there's certain things you should say and there's certain things you should not say. And then I'm also going to describe ways to improve communication with other healthcare providers. We communicate with a team. We are a team. There's multiple people involved in a hospital setting. You have the doctor, you have the nurse, you have the respiratory therapist, you have all other teams there. You also have a whole host of patients involved, family members, and so on. So you really need to understand how to communicate. And very importantly, you need to know how to communicate with the other team members. So what exactly is communication? We do it every day. We're doing it right now. I'm communicating with you and actually you're listening to me. So this is the other aspect of communication. It has one person talking, one person listening. So the idea of communication, especially when you think about communication in healthcare, is really vital. First of all, when we communicate with a patient and we are communicating with a colleague at the hospital or wherever you work, you're speaking about interventions such as prevention. You're talking about treatment plans. You're talking about therapy. You're talking about rehab. You're talking about promoting education and health promotion to the patient. So your dialogue is specific to healthcare. And all of this is achieved through verbal communication, and you really need specific skills to do it. So in reality, communication is the ability to communicate clearly and effectively with patients and your teams and is vital to improving the safety and satisfaction amongst your patients and your colleagues. Many patients convey their fears and concerns to you. And with that, we can really get a better understanding of how they feel. So how we react to them is really important. It involves conveying information through a range of verbal and nonverbal means. For example, if someone's expressing to you how they feel, a patient, and your body language has impatience all over it, that communication process is not going to work very well. So you really got to look at both your verbal skills as well as your nonverbal skills. And when I talk about nonverbal skills, I'm talking about body language. We also need to be good listeners. You know, communication is a two-way street where someone speaks and someone listens and it goes back and forth. I know as a human and as a man that I am flawed with mistakes with communication. I wish I spoke better. I wish I listened better, and I do my best. But you know, it's a practice. It's something you really got to be. You have to be cognitive of what you do, how your body language is, and how your facial expressions are. And if you listen to a patient and you listen to them clearly, or you listen to a close friend or a sibling and you listen to them clearly. So communication is really vital in healthcare. It really promotes safety and comfort and satisfaction amongst our patients. And then when you talk about communication between the healthcare team, it has to be effective and it has to get right to the point of what needs to be transmitted between one healthcare team and another. So let's now turn our attention to the pitfalls of miscommunication in healthcare. When you think about effective communication, it is essential to any business, but it's really, really important in healthcare. The effects of poor communication. So let's turn our attention to the importance of communication, especially in healthcare. So we all heard of the Joint Commission. The Joint Commission, which accredits the majority of hospitals in this country and some nursing homes and other facilities, they analyze root cause analysis of critical events that happen in the hospital setting. And guess what? Miscommunication is the most common cause of patient injury or harm or death. Communication breakdown was the root cause of more than 60% of all medical errors, and 75% resulted in patients' death. That's really serious. In other words, many people died as a result of miscommunication, and this, they believe, is the root cause of sentinel events in all categories. They did some data analysis on root cause analysis of problems that led from miscommunication. And regarding sentinel events, miscommunication was 75%. How about delays in treatment? That was 85%. How about medication errors? That was 65%. How about deaths and injuries? More than 80%. How about ventilator events? Our world, 65%. So really, communication in healthcare setting is really important because it really saves lives, and we need to be the best we can at communicating. I want to present to you a case study of miscommunication with a critical ill child. And I want to credit this case study to the link you see above, the first and second line of this presentation. So here goes. A 2-year-old girl was presented with a cough, runny nose, and a low-grade fever. The patient was swabbed for COVID, and it turned out to be negative. The patient went home, and the next day her temperature increased to 102.8 degrees Fahrenheit, and she wasn't responsive to any kind of ibuprofen or any kind of Tylenol, so her fever didn't break. Her breathing was labored, and then she had a respiratory rate of 50-60 breaths per minute. And at this point, she was taken to the local community hospital urgent care center to the emergency department. So at the community hospital, she was again swabbed for influenza, RSV, and again COVID. Again, all of the tests turned out to be negative, and they did a chest x-ray. The chest x-ray had normal findings. So at this point, albuterol was administered and a nasal cannula prescribed with high flow oxygen. For some reason, due to miscommunication amongst the team members, there was a delay in the administration of high flow oxygen. So the patient got the albuterol but never got the high flow oxygen. After several hours at the community hospital, the patient had a respiratory rate of 60 to 80 breaths per minute. She was hypoxic and her oxygen saturations were in high 80. Other observations were that she was grunting and being lethargic. So then the doctor on staff spoke to the patient's parents and told them that this is not a pediatric tertiary hospital. So in other words, they don't really specialize in children, and that if they wanted to transfer the patient, they could. For several hours, the pulse oximeter alarm was going off and no kind of interaction was done with the patient. So this patient was hypoxic, they were hyperventilating, they were lethargic, and the pulse ox is going off and nothing is being done. Let's continue the conversation about this child. The community hospital physician contacted the pediatric intensivist. The pediatric intensivist told them to increase the oxygen flow, which, remember, never really happened. They never actually put high flow on the kid, and to administer more albuterol during the transport. Because the patient was unstable and the vitals of the patient was really bad, the pediatric intensivist suggested that the transport be done by air and not ground, and so they contacted the flight crew and they told them what needed to be done. During the transport, the flight crew administered high flow oxygen, when you think about it for the first time, as well as intravenous steroids. At the tertiary care hospital, which are, they're the pediatric specialists, the patient was admitted to the pediatric intensive care unit with high flow oxygen, an antibiotic for bilateral ear infections, and fluids were administered, as well as Tylenol and ibuprofen. They actually came up with the proper diagnosis of adenovirus, and after that, the patient actually developed conjunctivitis and bronchiolitis, and that's the reason, because the adenovirus. After 3 days of continuous monitoring and treatment in the PICU, the patient was alert, responsive, and most important, hungry. So the kid was definitely on the mend. She was taken off supplemental oxygen after about 24 hours, and she was transferred to a regular discharge floor. So what is the lesson here? Because of the miscommunication and the mistreatment of this child at the community hospital, this kid was really, really sick. And you really think about it, the lessons here is when you have a hospital-to-hospital transfer of the patient, that transition is the greatest likelihood of harm to a patient. So inter-facility transfers are inherently important to have great communication between the healthcare providers, especially in this child. This child was actually on the flight and received high flow oxygen, steroids, and such. So effective communication and engagement amongst the providers, the patients, and the families is imperative to reducing harm, especially preventable harm for high-risk processes like this. Actually, the child and parents described in this case experienced preventable harm due to poor provider-provider communication and provider-family communication and family engagement. If you really think about it, if things were done right at the community hospital and everyone followed what they were supposed to do, this clinical outcome could have been prevented and this kid could have been doing some less suffering. It was misdiagnosing. There was actually mistreatments, like they never received high flow oxygen. They really didn't manage the kids properly. They didn't even make the proper diagnosis. So this is how important good communication is and engagement between healthcare workers. And I just wanted to bring to you this case study so you have a better idea of how miscommunication can impact patients. So let's talk about the Joint Commission's recommendations for effective communication and healthcare. So when you think about it, good communication amongst healthcare team members and between patients and providers is essential to high quality and safe care. I want to emphasize the communication between a patient and a provider. That provider could be the physician, it could be the nurse, it could be the respiratory therapist. Most improvement efforts to date by the Joint Commission have centered on provider-to-provider communication during transitions of care, especially during high-risk periods, or, for example, pre-procedural timeouts. That's where most of the focus has been. However, equally important for patient safety is the adequacy of patient-provider communication, allowing the patient's activation and as a result, the ability to become further engaged in their care. So what we're saying is, really, we need to emphasize the communication between the patient and the provider as much as we need to emphasize provider-to-provider care. So when patients become activated or they become engaged, they are more likely to follow medical advice and subsequently, they are less likely to require hospital readmissions. So the point is this, we need to really stress improved communication skills with the patient. We need to be able to listen to them. And this has been shown to be a little shift and change what the Joint Commission has wanted prior to this. While most prior attention focused on communication challenges related to patients with physical communication limitations, say someone with a stroke or a psychiatric disorder, it must be recognized that there's also a failure between patient-provider communication, and this can result in harm, even the absence of a disability. For example, common types of errors traced to patient-provider communication include misdiagnosis and medication errors. So what we really need to do is have strong patient-provider communication, and this has been tied to increased patient experience, decreased emotional stress, improved treatment adherence and compliance, improved health outcomes, and increased caregiver satisfaction and decreased burnout. So you could see how important it is when we think about communication. We should not just be focusing on provider to provider, but we should be looking at how we actually talk to the patient. With all of this, I'm sorry to say that evidence has suggested that communication between the patient and the provider erodes over time. So in other words, what we need to really focus about is good communication skills with the patient as well as communication skills with our coworkers and our team. I'm going to show you some techniques as we move forward, how to improve this. When a patient comes into the hospital, you can imagine that they are coming in for some kind of medical condition or procedure. And this is the most important aspect of good communication with the patient. So there are some basic understandings that you need to understand and you need to be able to relate to the patient. For example, clear expectation settings. I'm going to get a little bit more into that, but when you think about the expectation of a patient, when a patient comes in, if they got a simple bacterial infection and they take some antibiotics and they're in a hospital setting, they know the outcome. But there are patients with chronic conditions which really, the outcome can vary because they've been sick for a while. And I'm going to talk more about that a little bit. Another thing you need to do is you need to think about patient-centered approach to communication. What that means is that the patient and their family are very active in the dialogue, what's going on with their condition. Also, effective communication with a patient involves the sense of empathy. You need to be empathetic with the patient. You know, they're scared, they're anxious, and you really need to show concern. And empathy is a great way of doing it. And so what you really need to do is focus on a clear information exchange with the patient. You don't want to mislead the patient. You don't want to misguide the patient. You want to be direct and straight to the point. So the next few slides, I'm going to go a little bit more into the details of how to actually make this work. Let's further the conversation in regard to effective communication with patient care. And let's talk about, in particular, clear patient expectation settings. What do I mean by that? When a patient comes into the hospital, their hope that is whatever medical condition they have will be fixed. As I mentioned earlier, suppose you have a bacterial infection, you have a pneumonia, and you could take some IV antibiotics and take some bronchodilators and get better. So, you know, your expectation is kind of clear. But what about a patient with a chronic condition, such as, say, COPD? When this patient comes into the hospital, they are apprehensive. They're probably having a flare-up. So, you know, we all want the patient to simply get better. But with chronic conditions, that may never be the outcome. So it's critical to establish a patient expectations when you talk to them. For example, if they have multiple bouts of admissions to the hospital because of COPD, it's your responsibility to actually, you know what the diagnosis is, you know what the conditions are, but you need to sort of let them know about what the prognosis is. You need to be honest. You need to not lie to them. You need to be straight up. And sometimes, if you could have the family there, that's even better because you could sort of talk about it. They have some kind of support. So when you communicate with a patient in these kind of questions, you need to ask some questions. Some of these questions you could ask are, what are your expectations and goals? So you know you have COPD. What is your expectations and goal? Maybe their goal is to have this infection. They have a superimposed infection to get better. And then you ask them, what outcome are you looking for? What do you want to do? What is the quality of life you want to do? So you have to be straight up honest with them, and you need to be able to tell them that, you know, it's important that they understand what they have, they understand the prognosis, they understand how chronic diseases can alter your life. So the most important thing you could do is show some compassion and feelings for them. That is empathy. This is really important. So these are some of the ideas with patient expectations. In other words, be honest with them, be straightforward with them, tell them what's going on, tell them what the prognosis is, especially in the cases of chronic disease. Another effective process of patient communication is when you utilize what is known as a patient-centered approach. And more health organizations are having this approach, where this means that healthcare organizations, they basically want to enhance what is known as patient activation. So what is patient activation? Patient activation is achieving goals for the patient, thinking about the patient, and making sure that the patient is involved with all decision making. In other words, you bring them in. You just don't treat the patient. You actually tell the patient what you're doing, what the plans are, but you have them be involved with that. Maybe this is through education, whatever. Some of the key aspects of that is that patient activation or patient-centered approach improves patient safety guidelines. It also involves patients and their families or partners at every level of care. So in other words, if you have someone at home, a loved one at home who knows that you have a chronic condition, the best thing in the world is for them to understand what you have, maybe understand the medications you need, maybe understand things that can trigger a adverse reaction. So really, this is really, really important. So many studies have been done on this, and the Joint Commission actually, approves this kind of approach. So the idea at this is to have the patient involved in their care, discuss what's going on with the patient, discuss with the family members what's going on, at least family members who the patient wants to talk to, or say a significant other the patient wants to talk to. This is called a patient-centered approach, where you have the patient very active in their care, and they understand what's going on through good skills of compassionate communication that you make. I wanted to go a little bit more into the patient-centered approach, because this is an approach that many healthcare organizations are making, and it's your job as a practitioner to follow this role. So basically, as I mentioned, a patient-centered approach to communication ensures that patients play an active role in the dialogue. In other words, you really want them to give you feedback that they understand what you're saying. Some of the key elements with that is patient safety. If you're going to prescribe a medication or you're going to prescribe a procedure, you have to let them know the aspects of safety. You also need to speak to families as partners. In other words, as I mentioned earlier in the previous slide, if you have a loved one home with you and you have a chronic condition, the best thing in the world you can do is explain exactly what's going on. Say, for example, you're admitted to the hospital for an exacerbation of asthma. Triggers, medication regimens, that steroids are basically a maintenance drug, where a bronchodilator is a rescue drug. So letting the family know, letting the patient know, letting the children know really helps. You need to also disclose unanticipated outcomes. Certain medications have side effects. So, effective communication is to give them a deep understanding of some of the side effects or unanticipated outcomes. You might end up being readmitted to the hospital if you don't follow a certain regimen. So basically, hospital staff need to be licensed, they need to demonstrate skills and knowledge, and they really need to understand how patient-centered care works. And patient-centered care starts from the top. It's the leadership in the hospital buys into this approach, gives the formal education to the staff, and this has really improved customer satisfaction, and your Press Ganey scores will go through the roof. So when we think about effective communication in patient care, you need to be thinking about empathy, clear expectations, and patient retention of key information. Empathy is vital to communication in healthcare because it involves understanding and sharing a patient's perspective without any kind of judgment. It's the ability to understand a patient's emotions, which can lead to more accurate diagnosis and caring treatment. You got to think about it. Empathy also builds trust, increases patient satisfaction and compliance, and improves recovery rate. So when you express empathy with the patient, this is one of the must with clear communication. Now, we went into what the expectations are when we're talking about patient expectations for their disorder. If it's a chronic disease, you need to be honest, you need to be forthright. If it's a disease that can be treated with a simple antibiotic or an antiviral, you need to say it. Or if it needs to be some kind of surgical procedure, you need to explain the whole thing to them. You don't mask what's going on. And another very, very important thing is retention of key information. And for example, a good way to know if someone understands what you say to them is actually have them repeat it back to you. In other words, you say something to them and you say, do you understand me? And then they could paraphrase it and come back to you with their explanation. This way, there's no miscommunication going on. You need to be a very good listener. You need to listen to what the patient is saying, and you need to make sure they understand what you're saying. But in this regard, we're talking about patient retention of key information. You want them to give you feedback that they understand what you're saying to them, they understand their prognosis, they understand their treatment plan, and rather than nod their head, you need them to verbalize that they do understand everything you're saying. These are some of the key elements of effective communication with patient care. So in summary, regarding effective communication in patient care, you need to have a clear focus on information exchange with the patient that promotes their understanding and retention of key information. This is vital to the communication process. If you understand this one paragraph right here, this is everything you really need to do to communicate effectively. Now, as much as we put effort into communicating effectively, sometimes there are barriers. And I'm going to go over some slides now talking about barriers of effective communication. The concept of barriers in communication is not a new one. In everyday life, we have many misconceptions that occur with communication between people. I live it every day. Sometimes people really don't understand exactly the point I'm trying to make, or I'm misunderstood, and so on and so on. So when you think about barriers of communication in healthcare, you got to remember it's a two-way street. Basically, you have the patient's misunderstanding of what the healthcare practitioner is saying, as well as our understanding as healthcare practitioners, misunderstanding of what they're trying to say to us. So when I first talk about this concept, I want to approach it from a patient's point of view. So this is a patient's point of view where misconceptions can occur, miscommunication can occur. Some of the common themes, they've done some studies where they look at miscommunication, communication barriers between healthcare practitioners and patients. And from a patient's point of view, some of the differences lie with such as age differences, gender differences, cultural differences, and also the condition of the patient. Is the patient anxious? Are they in pain? Do they have physical discomfort? So I'm going to get a little bit more into this. So let's talk about age difference. From a patient's perspective, a patient who is talking to a healthcare practitioner would rather speak to someone close to their age. And the reason for that is that they feel there's more commonality there. For example, younger patients have a higher expectation of provider communication than someone who's older. Basically, younger patients, they search the internet, they know a lot about their medical condition, and they want to be involved in their own care. So in other words, they want to be a partner with the healthcare team member, and so they really expect you to know more about what's going on with them than, say, someone older. When someone's older, they may put more trust in the physician, so the communication that the healthcare practitioner makes to an older patient has to be more geared toward letting them know that you got their back. You have their full understanding of what's going on. So this is where age differences come in. Let's talk about gender differences. Gender differences, some people rather speak to someone of the same sex. I have a story at one time when I worked in a hospital where I was a manager at this point, and I got a call from one of my therapists that the patient didn't want a female respiratory therapist to help them. And I got a call from the family member to go up there, and I wanted to know what was going on. And basically, it was a elderly Jewish man with his wife, and he really didn't want to be treated by a female respiratory therapist. It had nothing to do with sexism as much as it had to do with the fact that in his religion, that you cannot touch a male figure. If you're a female and you're not the wife, you really can't touch the patient. As crazy as it sounds, you have to respect people's religion and understanding. So I personally took care of that. So gender differences do make a difference. A lot of people feel that women healthcare practitioners are more empathetic to the understand. They feel that they more talk to them. They demonstrate more psychosocial connection with the patient. It may be true or not true, but a lot of studies have shown that, and actually studies have shown that male doctors and female doctors, the consultations that take place between them and the patient, it seems that female doctors are a little bit more empathetic than male doctors. So, gender differences do have something to do with it. Let's talk about cultural differences. Cultural differences from a patient's point of view is that, studies have shown that, there's more more of a understanding between the same race. For example, it has been shown that with black patients, if you have a black healthcare practitioner treating a black patient, that the patient actually has better outcomes. As crazy as it sounds, there's sort of a commonality there, and I'm just using this as an example of where people have more trust and understanding and probably better communication at this point. When you think about anxiety, pain, and physical discomfort, if someone is a patient and they are sick and they are ill and they're anxious, they're in pain, sometimes the understanding and the communication between both of them can be a little bit off. So sometimes as a healthcare practitioner, you have to recognize that the patient can be in pain, they can be anxious, they can have some kind of physical discomfort, and you really need to treat them a little bit differently than in most cases. So these are some of the common barriers in communication, and really what you got to do is work on ways to overcome them so that you have better communication. As I was saying earlier, this is about communicating between a healthcare practitioner and the patient, and this is from a patient's perspective. So now let's turn our attention to barriers of communication within healthcare, but let's talk it from a healthcare perspective rather than the patient. So what are some of the barriers that occur? And similar to a patient's barriers, age difference. It seems like healthcare practitioners can relate better to someone close to their own age than they can to someone much younger or basically much older. So age difference is a key factor to barriers of communication. And they've done some studies with the unfamiliarity with the patient's medical condition. So a lot of times we'll go in to treat a patient. We know that they're admitted because they had a COPD exasperation, but we're not familiar that they have some kind of heart condition or some other condition. So a lot of times a patient may ask questions about their medical condition that has nothing to do with what we're doing. For example, if we're going in there to do a nebulized treatment of albuterol, and the patient is asking about their, diabetes medication or some other thing, and we don't know about it, sometimes these can create barriers with communication with the patients. Cultural differences, as I mentioned earlier, this works both ways. If someone's from a different culture, you may not be able to relate to them. Sometimes people of different cultures are closed to talking to people. They're very uncomfortable talking, and we can feel the same way. Medical language differences. Sometimes we speak in terms that are, really how we're trained. We're medical experts. We speak in languages and we use terminology that is very common to speaking to a coworker, but may not be common to speak to a patient. How about being overworked? How about you have too much of someone called in sick during a shift and now you have no time to talk to the patient? So in other words, your workload has increased, and as a result, you have less time to do everything. So having an extended conversation with a patient may not be the best. So the perception of the patient is that you rush the whole thing, but they really don't know that, you're short of staff and things like that. And the same thing could we go with staff shortages. Sometimes, we don't have enough therapists or healthcare practitioners to cover a shift. And as a result, the price that paid is that we don't really do much talking to the patient. We don't really communicate effectively with the patient. So all of these barriers can result in miscommunication and poor communication between the patient and the healthcare worker. And finally, we get to unsuitable environmental conditions such as a shared room. Sometimes, if you have a shared room, you want to be discreet about when you talk with the patient about their medical condition. You really can't be saying things that can be basically a HIPAA violation if someone in the room overhears you talking. So sometimes we may not say things that we should be saying to the patient because we're conscious about that someone else might be overhearing what we're saying. So all of these things add up to barriers in communication. Some of these things are misunderstandings between the therapist and the patient. And as I mentioned earlier with the previous slide, you have the patient and the therapist. So we got to overcome some of these things. We got to sort of improve our communication. And I just mentioned here the barriers. Next, we're going to be talking about ways to improve the communication between the healthcare practitioner and the patient, and also from the patient to the healthcare practitioner. So let's move on. Everyone benefits when you communicate effectively with your patient. The patient benefits, the family benefits, the hospital benefits, and you benefit. So there are certain strategies that we can do. We're going to get a bunch into the strategies to improve your communication with the patient. And some of the basic things we got to do is establishing rapport with the patient. What that means, you make good eye contact, you smile, you use nonverbal cues like good body language and gestures. So this way the patient feels comfortable. You also want to be empathetic. What that means is you want to listen attentively and you want to acknowledge the concerns and show understanding that maybe makes the patient feel that they are being heard and understood. And this way you build trust. Another very important thing is you need to use plain language. You got to avoid medical jargon and confusing language. And you need to explain concepts that are really easy to understand. Break it down to every simple language. Instead of saying, a nebulizer, you might want to just call it a puffer. These are certain things you can do. Avoid the medical jargon, and these will really improve the communication with the patient. Another very important is ask questions. When you ask a patient to ask you questions, you make them open-ended questions. So in other words, you encourage the patient to ask questions to you. This way you learn about their perspectives, their attitudes, their motivations, and this builds trust with the patient. Another thing you need to do is personalize the exchange. What do I mean by personalize the exchange? You want to give actionable and personalized instructions and advice so that the patient is ready to learn. In other words, you want to make whatever conversation you have with them very personal to the nature that it directly impacts their care. Again, another very important thing is to allow time. You know, you got to give patients enough time to speak. I know we got busy times and we're short staffed and we're overworked, but you really got to give enough time for the patient to understand what you got to say. Maybe they can repeat back to you what you said to them and paraphrase it. So, but these are very important strategies. And finally, be organized. You need to organize your time. You need to minimize your potential biases. You need to make a better impact with the patient. So some of these are some basic strategies, and I'm going to get a little bit more into it on the next slide. So I want to further up the conversation regarding effective communication techniques. And there's been a lot of studies on building rapport with the patient, and how you can do this is what is known as the BATHE technique, the BATHE technique. This is a psychological technique that you use with patients to improve the communication, build trust amongst them. And when you think of the word BATHE or bathe, think of the word background, affect, trouble, handling, and empathy. So what does that mean? Basically, when you ask, some of the things you could do is you could ask, what's going on today? How are you feeling? You get a little feedback from the patient. You build a little rapport. This shows a little that you have empathy, Then you could think about affect. So what is the concept of affect? Affect is asking the patient how it is impacting them emotionally. So in other words, this really goes a little bit deeper than a topical conversation. You really want to know how they feel about the whole thing. And then what you have is known as trouble, the T part. So trouble means what is really happening today about your medical condition, and what is really troubling about your medical condition. These are what is known as the trouble aspect. Then finally, you ask about handling. Handling is ask the patient how they're handling this so far. How are they managing their emotions? How are they managing their stress? How are they managing their anxiety? You obviously see from these line of questions, you're getting very personal with them. And that's the whole point here. You're not keeping the conversation topical. You're actually showing empathy for them and concern, and this will build trust. Finally, empathy, like I just said. Show the patients that you are really listening to what they're saying. Do active listening. The most important thing in communication is to be an active listener, to really understand what's going on with them, be genuinely concerned about their welfare. All of these things will really improve the conversation with the patient. And very importantly, when you're talking to them, make sure that if you have an opportunity to sit down and be humble, do it. Keep an eye-to-eye contact. Don't be standing over the bed that they're looking up to you, because this creates a bad vibe. Also, you need to ask open-end questions. Open-end questions rather than yes and no. Patients often feel uncomfortable voicing their concerns if you don't have an open-end question. So really keep it down to some open-end questions. All of these strategies are really important in improving the communication with patients, to build the trust and rapport with the patient, and that's exactly what you want. And this is going to come out in benefits to patient outcomes, as well as job satisfaction, and probably some good Press Ganey scores. So I want to summarize some of the best practices you could do with communicating with a patient. And these things are really important. First of all, you need to be an active listener. I think we all could benefit from being an active listener. Active listening is a communication skill that involves more than just hearing what someone says. It's about being an engaged participant in the conversation. You need to actively process what is being said, and you need to try to understand the speaker's meaning and their intent. You need to really pay close attention to what the patient is saying throughout their whole ordeal, and you need to be able to read some of their feelings about this. Being an active listener is really, really important. The next ability is obviously you need to show empathy. Empathy builds trust and rapport with the patient. Empathy can be the ability to understand and share the feelings of another. That is actually the definition of being empathetic. And regarding an introduction, when you come in the room, obviously introduce yourself. Even if this is maybe the second or third time you've been there, you need to introduce yourself. You say, hi, my name is Terry. I'm your respiratory therapist. I hope you're doing well. Is it okay for me to come in? You need to knock at the door. You need to show respect with them. This way they will open up to you. Another very important thing, which you could do a whole lecture upon, is called situational awareness. Being a healthcare worker, being situationally aware of what's going on is really important. When you think about situational awareness, this is the ability to observe and understand the environment. You need to be able to read what's going on in a room. If there's someone in the room, like a family member, and they look tense, you got to be able to pick up on that. If you look at them and they look sad, you need to be able to see this. You need to look at the patient and make quiet observations. You need to be able to recognize potential issues before they occur, and you need to take appropriate action to avoid this. You know, we all need situational awareness. This helps us in everyday life. And like I said, you could really do a whole lecture just on this. And I've heard lectures on this. But become situationally aware of what's going on. It's more than verbal. It's about body cues. It's about environment. It's about who's in the room. It's about reading the patient without saying a word. These are very important aspects. And finally, questions. Open-end questions are the best thing to do. Why? Because they provide a deeper understanding of the patient's experience and preferences and challenges. If you have open-end questions, you could really tailor your conversation and your treatment to them based upon what they're saying to you. So these are some of the basic understandings of how to have proper patient care. Let's get into a very important part of communication with the patient, and it's the nonverbal communication. Listen, we all can benefit. Did you ever have a conversation with someone who's not a patient and they're telling you one thing, but their face and body language is telling you another? Believe me, nonverbal communication speaks volumes. If your verbal and your nonverbal messages don't match, people believe your nonverbal messages. So in other words, you could say one thing, but if your face and body language says another, they do not buy into this at all. If you walk into the room and someone says, what the hell's wrong with you? You look really angry. And you say this to them, but how about they were in pain? How about they heard some bad message or some bad phone call they had, or maybe they had bad report from the doctor that something is going wrong with them. So you really got to pay attention to nonverbal languages, and you need to be able to display messages nonverbally. For example, facial expressions. You know, if you walk into the room and you're smiling and you say hello and you don't look rushed or anguished, you're going to be, people are going to receive that very well. So you need to really pay attention to nonverbal signals of your patient, because if you don't, you really might be missing something important, really important, and respond in a ways that is really may appear insensitive and uncaring. So pay attention to nonverbal presentations of the patient. You need to look at nodding. When you're talking to someone and they say something to you, nod with agreement. This way they know exactly what you're saying. You know, when patients talk to you, you need to have the proper posture. You can't keep your arms crossed and your head cocked to one side and tapping your foot because it looks like you're impatient and you're sending all kinds of bad signals to the patient. So really, you need to have good posture. You need to nod when they talk to the patient. You need to read facial expressions and eye contact. Eye contact is so important. You need to not stare at them. And culturally, this can work for different situations. Certain cultures do not want prolonged eye contact. So you really need to be professional about how you handle it. Keep it at a minimum, but genuinely look at them when they speak something that's very concerning. Definitely give them good eye contact, give some good body language and appearance. If you walk in the room and you look disheveled and you look like your hair's a mess and you look like you got some lunch on your mouth from you got some chicken soup on your lip, really it's really important to have a proper professional appearance, and I'm sure your job tells you exactly what you need to do and what you don't need to do. And finally, the word touch. A touch is nonverbal, but in the right circumstances, if someone is telling you something and you want to show empathy and understanding and you really know how to manage your body language, you may want to touch them on the shoulder and say, thank you very much, or you want to shake the hand or something, some kind of physical gesture to the patient. Sometimes this can really do wonders for them. So some of these things are your nonverbal communication with the patient, and you need to be a master of all of them for both your professional life as a respiratory therapist as well as your personal life. Listen, no matter how good you are, there are going to be times when you're going to have an angry patient. They are going to be pissed off about something. It could be pain, it could be fear, it could be increased anxiety, it could be frustration. It could even be that they got some bad news that they are, terminally ill. So how you could pick this up is you need to look for the signs. You need to look at body language. You need to look at the tightened jaw, the tense posture, clenched fist. You need to look at fidgeting. You need to observe these physical signs. Then the second thing is you need to act fast. When you see someone is going to be really angry and upset, you need to do things to de-escalate them. And I could give a whole lecture on de-escalation, but the point I need to say is that sometimes anger could turn into physical anger, so you got to be prepared. You got to be prepared to seek help if you need it, and you need to be able to do things to keep your distance from the patient. You never know what's going to happen. Very importantly, you need to document. You need to document this interaction. If it is not documented, it's not done. Sometimes documentation will show a history of anger with the patient, and you need to know what can do to reconcile this. Very importantly, you got to keep your cool. You can't blow up. Just because they blow up, you can't blow up. You need to be right on top of what you need to do. You need to manage the patient. You need to do your best to de-escalate them. You need to speak to them in a calm language. You need to keep a certain amount of distance from them. You need to explore exactly what's going on. Obviously, I could do a whole lecture on managing an angry patient, so the best thing you got to do is look for resources on how to do it. I just gave you some quick synopsis on what you got to do. I want to thank you all for joining this presentation. I know I could spend at least 2 or 3 hours covering all the topics here, and maybe I'll develop some new topics. But in summary, one of the best ways to improve patient satisfaction is via good communication. You need to be a good communicator. You need to be a good listener. You need to pay attention to language and culture. Every culture is different. You need to be able to speak to people in a language they understand. You need to speak to them in a tone that they understand. You need to be empathetic. Another thing, very importantly, is nonverbal communication. Nonverbal communication is everything. You need to pick up on body language. You need to display proper body language. What comes out of your mouth better match what comes out or on your face. You can't be a two-face. And finally, you need to be a professional. We are professionals. We are trained to take care of patients. That means that taking care of a patient is just not medically. You need to be from a social level and a human level. You need to be able to be a professional and take care of them. And if I didn't teach you everything you needed to know, you need to seek the guidance out there. And again, I want to thank you all for joining us. Here is a short list of references that I used during this presentation. I have many more that I use for this presentation, and if you have any need for them, I will absolutely share them with you. And I want to thank you, and you have a great day.